The Burns and Plastic Surgery Department at Kiruddu Referral Hospital, in partnership with a team from Resurge International organization, will train young surgeons and transfer skills from more experienced hand surgeons, as well as establish a hand unit in Uganda. The hand problems handled at the camp include trauma cases like fractures, tendon injuries, nerve injuries and digit loss, congenital cases and post-burn cases. So far, over 60 patients have been handled. Dr. Alenyo highlighted some of the common hand cases registered at the hospital.
We've seen paralysis after injury in accidents. We've seen children that get nerve injury during the time of delivery. We've seen quite a number of burns. People who had burns involving their hand, very complex ones.
She said that most recorded cases are in adults that deal in the glass, electricity and wiring. Others are from road traffic accidents and burns. Dr. Alenyo mentioned some of the signs and symptoms of bacterial hand infections arising from hand injuries.
One thing is pain. Because when there's an infection in the hand has got very little space between skin and bone. So every infection will cause a swelling, and that swelling will cause a lot of pain. And of course the next is swelling. The finger or the digit that is involved will swell more than the others. And then 3 is not, especially children, you may not know that there is a problem, but when they start refusing to use the hand, then you realize there could be a problem. Then you also get things like fever, because if you have an infection any part of the body, you start to have a raised temperature. So when people have fever, we also make sure we look for infections that are in their hand or any other part of the body.
And then what are the possible preventions that someone can take to avoid these infections?
Infections usually come from hand injury. People who go to the garden get hand pricks, because traditionally we don't wear gloves when we are digging or doing anything. And remember, when you get the infections in the garden or in dirty old rusty equipment, you can get tetanus, which then you present with the whole body sick, and some people may die. So usually for hand infection is, if you notice those symptoms of swelling, pain, you need to get treatment. If you get treatment early, they will always resolve. There are minor infections that resolve by themselves. But
she urged the public to take every hand injury seriously and consult medical workers immediately they notice some signs of hand injuries. She also gave first aid where a person accidentally cuts off their finger.
You cut off your clean finger, you have to put it near a box of ice or ice in a cloth, and then you carry it to the hospital. That makes it alive for at least 4 to 6 hours and can be replanted back. And also we hope that at the same time, if you lost a digit like a thumb, if you lost a thumb, you've lost 50% function of that hand. So if you lost a thumb, we should be able to either convert the next digit to a thumb, or to get part of your toe and make it a thumb, because you can do away with one toe and you still walk perfectly well, but you can not easily do away with your thumb. So we can replace a thumb if we had a microsurgery.
The camp has a team of anesthesiologists, hand therapists, physiotherapists and surgeons from Johns Hopkins University in the UK and medics from the Burns and Plastic Surgery Department at Kiruddu Referral Hospital. The free services to hand patients will run until 1st April 2023. Mary Prima Award, Church of Uganda Family TV, News at 8.